for pressure ulcers and prevention of them. Here's a poster board that I got made. I'll leave in the lounge for us all to look at. And I know you guys are thrilled about a quiz afterward. Yeah, I know.
Gotta have documentation
Yeah.
of it.
So I'll go ahead and start handing these around. If there's not enough, I'll make more copies.
If you want to do that, if you wanted like put those on a clipboard, make it when they do this, can do the quiz and.
Yeah,
I'll do that.
I could do
What
that.
happens if you pass them out now, they're gonna get lost.
Oh, don't lose them,
Unless
guys.
you want to do them now, you know, so, but they need a chance to look at this and.
Yeah.
Do
Okay.
that first.
I guess I'll
Do
wait.
that.
Okay.
That way, because I have a feeling if you pass them out now, they're gonna get misplaced, just like
Okay.
a lot of things do.
So if these get lost, go to her. She'll have extras.
Oh, well, yeah, that's what I'm wondering. So.
I've also got candy for people to answer questions right.
People need to be quiet or you need to talk louder, but I can barely hear you. Mike.
Sorry, I'm not used to being up here.
That's okay.
Yeah, toss
Just let
those
you know.
whenever people get.
Okay, all right, okay.
All right. So we all know about pressure ulcers and the things that come with them, the detriment to someone's life and the way they live, and so I want to talk a little bit more about them specific to the OR. So I got a magazine in the mail from AORN after doing the Pre-Op 101. The first thing I saw was pressure ulcers and prevention. I was like, okay, this could go hand in hand with what I came from and what I'm doing here and now. So 2.5 million people develop pressure ulcers in the hospital each year. How many of those do you think originate from the OR? If you give me a percentage, show me a number.
20%.
20%. What else? 30? 60? Closer to 60? 45%.
Who said 60?
Mike?
I want to throw things.
I was shocked when I heard 45%. I was like, wow, that's crazy. I did not think that half the pressure ulcers developed in the healthcare in the hospital were from OR. So I just thought that was crazy. But I feel like there's a real need for improvement if we could help it, if we could help prevent some of these things that happen. So what do you think a pressure ulcer is? Do we have an answer on that one? Someone describe me a pressure ulcer, Ryan? You know, no?
Go ahead.
All right.
Breakdown of tissue.
Do what?
Breakdown of tissue.
Yeah, it's a localized injury, breakdown of tissue. It's non-blanchable. That means if you push down on it and it turns white, but it doesn't turn red after that, then it's non-blanchable. You want it to be, you want it to push down and change it back to red, so you have the circulation in there. It's usually because of bony prominences over pressure, like your hips, your shoulder, your elbow, something like that. And it says the OR acquired ones are ones that appear between 48 and 72 hours after surgery. That's how they get to that number, not 45%
Who
number.
answered that question before? There was
Pressure
a
ulcer.
question answered there. Here we go. Catch something.
Throw it, throw it.
Underhanded?
Underhanded.
Oh, come on.
Just someone fit like a,
Bunch
right
of-
here.
Yeah.
Bunch of sissies.
But just I'm beaming at you.
So Debbie might know this answer here. Picking on you, I know. What are the stages of pressure ulcers? What are the numbers? 1 through what?
4.
4, yeah, you get a treat. Who else said 4 to get one?
Everyone gets a treat. Here, just
Yeah.
pass it out. There's one here that's open.
Oh, no.
That's yours.
Sorry, that was mine. That's
Oh,
the one.
she ate it.
It was in the package. It just fell out.
It seriously was. I just opened it. But yeah, stages 1 through 4. I won't go over those, but they're here on the chart here. So if we look at that, we would think about how to prevent some of these things here. Here's stage 1, 2, 3, 4, and here's one that they've developed. It's a deep tissue injury that's not really stageable yet, and then here's ones that's unstageable. I guess not able to do that yet. So look at prevention. There's some scales that we look at. Nursing school, we had Braden scale. You guys are familiar with that one. Scores from 0 to 23, or sorry, 6 to 23. When you have 6 or just a little bit above that, it's a very high risk for pressure ulcers. Anything above like 19 to 23 is a low risk pressure ulcer. So you could look at that. Pre-op may be able to do a Braden scale right there. This would be kind of hard for us to do pre-operatively. But we have something here that we might be able to use called Scott Triggers. A woman named Susan Scott made it a couple years ago. It has a very short list. It's based on advanced age, your albumin level, your ASA score, and the length of procedure. And all those we could pick up very quickly.
Something about the Braden scale, though, it's done on every admission, so.
Oh, is it? Okay.
I believe it's done on every admission. So inpatients, you already have one. I don't know if the outpatients have one, but especially for inpatients, if you look at the Braden scale, you can determine what your.
Yeah, we did it as inpatient. Every 24 hours, you had to have a Braden scale. See if there's any change in there.
They have to have it on admission, too.
In admission, okay.
I think so.
Yeah, thank you. So, what's the best way to prevent pressure ulcers? What's an easy way to do that? Someone name something.
The sacral dressing.
Padding.
Sacral dressing, padding, yeah, foams, gels, limiting your fluid that goes underneath the patient, blood loss, either water, maybe get down there, your betadine.
Good nutrition, too.
Yeah, good nutrition, yeah, keeps our albumin levels up for healing. Bear huggers, those are important in the prevention of pressure ulcers. I didn't realize this, but induced or hypothermia is actually one of the biggest causes of pressure ulcers. There's a stat I got here. Where is it at here? So it says each degree of change below the normal increases the risk of developing pressure ulcers by 94%. I couldn't believe that. That was crazy. So what do you think some of the intrinsic factors are for someone developing a pressure ulcer? I mentioned one with age. Yeah.
Debility, actually, if they're.
Mm-hmm. Yeah, debility.
Nutrition.
Nutrition's one. Obesity is
Obesity,
one.
or
Diabetes too. Yeah.
not only obesity, but just the opposite too, if they don't have enough body fat.
That's right. Yeah. Low BMI,
Yeah.
high BMI. All those cancer, PAD, PVD, all that could be your medications they're on. Steroids will do that. Vasoactive drugs will do the same thing. A low H&H, if they have a lot of blood loss, you have less circulation, less blood in your body to do that. Let's see, what else we got? Low blood pressure, kind of the same thing with low H&H, kind of goes along with that. Some I can't even say it. I can't even say that.
What?
I can't even say it.
Extrinsic?
Yeah, you go.
Extrinsic,
Yeah, there we go.
yeah.
Yeah, some of those factors. What are those? What do you think those could be?
Extrinsic factors.
Cords,
Laying
Yeah,
on cords,
laying in something wet, like wet sheets, damp sheets.
Mm-hmm. The positioning, length of procedure, the blood loss. The thing that we could prevent a lot is the friction and shear. I know when we move people across the table, I noticed that sometimes they're moved pretty quickly, or they're not laying just right, and you pull on their gown and they're not laying quite, or not over just enough. We could cause a pressure ulcer from that. The body temperature, of course, you don't put a bear hugger on them when they probably need one. All those are the same as those risk factors from the outside, from us. Let's see what else we got. Pressure points, common pressure points I've got down here is a little diagram. So your head, your sacrum, your knees, elbows, I kind of mentioned all that earlier. All those are some of the common pressure points. Who can name me some of the common positions in the OR? Lithotomy, yeah. Lateral. Lateral is a big one right there for pressure ulcers. If you don't lay them right, or pad them just enough. These dressings here are made to help prevent. I'll move this over here so I'll see it. Are made to put on the backside, the coccyx and sacrum region. And you put it on just like this, with the heart upside down. If you're worried about incontinence, if you're not, you can flip it over and pad a little bit more area. So I really like for us to try to use these if we can. Just thinking about the length of procedure, if it's over 2 hours long, think about putting that pad on just as prevention. You can put it on open wounds back there too. You can actually do that. So it's really helpful. It doesn't hurt them at all. It's easy to take off when they leave. So, yeah.
Is the OR responsible for putting those on?
I don't ever see them put on pre-op at all.
They're not on, we need to.
Yeah.
If they're not on, we need to.
I thought they discussed that the rep was saying she was gonna talk to pre-op and was supposed to educate them and tell them that.
I'll look into that. I'll look into that and see what happened with that, why they're not doing, they did it for a little bit and then I haven't seen it in a long time. So.
Yeah. I know Nancy's done a pretty good job of putting them on. She's contacted me about how to put it in the chart, the flow sheet there. So I know she's doing a pretty good job with that. I know yesterday she called me and asked me about one. I think it's a Hargis patient. You're working on. That you did that on. So.
It was a Pappas.
Oh, Pappas. Okay, Pappas patient.
5 hours.
But yeah, so if we could utilize those more often, we actually have more of those. These are actually heel protectors. These are bigger ones for the more obese patient, and some of the smaller ones for elbows or joints. I know Wound Care's got a lot more of these things too. So, but anyway, that pretty much sums it up there. What? Oh, these are all in the general supply room. All in the general supply room. That's where I got them. Yeah, every one of them. I think another thing I don't see often, I don't do it sometimes too, is the communication of relaying it from us to the post-op unit. If they've got the Mepilex dressing on, any wounds they might have coming to us, we should relay it to the post-op team, and hopefully they can relay those messages to the unit of the floor upstairs. So anyway, that's all I've got. I'm trying to make it short and sweet so he can get his thing going. So any questions for me?
So what we need everyone to do, oh, I'm sorry, go ahead, yeah.
I'm wondering if that's something that we could ask Vicki to add to our carryout note,
The,
you know, where we document STDs and body temperature, all the rest of that stuff. That might be a good thing to add there as a reminder.
Yeah. I really think it'd be a big improvement if we
yeah.
put together maybe some people to start working on that.
I think we just need to, and I think what needs to be done is it just needs to be brought to awareness more too, that if this isn't, like Nancy was really good yesterday, she called and asked for dressing, I brought her dressing, so you need to be aware if you're going to have a case that you anticipate lasting longer than 2 hours, this patient needs to have one of these sacral ulcer dressings on. And so we just need to be aware of that, and I think we need to reinforce it with the pre-op right now too, I think, so we need to do. I'll talk to Emily about that and see about educating them on that. And look at the Braden scales, because that's really important too. At what point on the Braden scale should you have prevention? What's the score?
Well, I mean, it could help everybody if you have one, but there's never a bad thing to ever put it on someone. Okay. But anywhere from score from 18 below could be pretty good to use one. Yeah. And
also we have those purple mattresses are low pressure. They're pressure management mattresses. So that is another thing that we have done to help prevent this too. The pressure management system mattresses.
Remember, if you have the purple ones, you don't need gels.
Yes, in fact, you should not have gels on it if you have the purple mattresses, because that defeats the purpose of it, and actually may hinder the protection. It'll hinder the protection of the purple mattress.